Good morning, good evening, good afternoon, depending where you are in the world, to our audience and then to our three speakers. So my name is Donald Bisanzio. I'm a senior epidemiologist in the Global Health Security team, RTI, in International. So just like a few lines about my background. So I'm a veterinarian as a background, but I've been working on several diseases since 2004. So in RTI International, so my job is to support countries in facing different health issues by providing them support meta-analysis, modeling. And during the last 10 years, I work on different One Health issues, for example, Ebola, and then monkeypox, COVID, and so on and so on. So for people that they don't know about RTI International, so RTI International is a global research institute and also international development organization. So we merge our skills with external partners, like, for example, Eastern Mediterranean Public Health Network, HealthNet. And with them, we kind of create solutions and we support different countries in facing emergency or facing also health issues, like, for example, the one under the umbrella of One Health. And this is why we are here today. We are going to talk about One Health. And then, as you know, One Health, the idea behind One Health is that the well-being of humans is not just about, having the human healthy. So we also need to have good health in animals and in plants, because we are all interconnected. And this also brings to the issue that when we want to do One Health, when we want to approach One Health and then create a kind of One Health system, One Health approach in different countries, so we need to have a multi-sectoral approach. So we cannot just look at medicine, we cannot just look at veterinarian or agriculture, we need to put everything together. And this is the title of this webinar today. So this is Sustaining Meaningful Multi-Sectoral Collaboration for One Health, Condition for Success. And today we have like three amazing speakers. They're going to talk about their experience in their countries in which they apply One Health. So we have Dr. Anida Rahman from Bangladesh, Dr. Mubasher Farag from Qatar, and Dr. Sisai Katechwa from Ethiopia. So they three, both they are going to talk about One Health and kind of like describe how the multi-sectoral approach works in their countries. And before starting, I want to just like some housekeeping rules. So first, if you have any questions, you can add the questions inside the Q&A chat, and then you are now going to ask questions through your microphone. So this webinar is going to be recorded, so you have the possibility to share the link and so on with your colleagues, or just like rewatch it. So without further delay, I would like to introduce Dr. Anida Rahman. Is Deputy Program Manager of Antimicrobial Resistant, Viral Hepatitis, the Real Disease Control for the Government of Bangladesh. So Dr. Rahman is an epidemiologist and a medical graduate. He's working as the Program Manager of the National Antimicrobial Resistance Containment Program under the Ministry of Health in Bangladesh. She has been involved with the development of major national policy level documents and guidelines on MR containment in One Health approach, and is now involved in implementing those strategic activities in Bangladesh. So what we can say about him also is that passionate about public health and wants to keep contributing to the communicable disease control aspect of the global health system. And I leave the stage to you, Dr. Anida Rahman, and I'm very pleased to see you here. Thanks.
Thank you very much, Dr. Donald. I hope I'm audible and you can see my slides. Just let me know if it is in presentation mode or not.
Yes, so we can see it. Can you just put like in a full screen, like in presentation mode? Because right now we see your PowerPoint.
Yeah. Is it okay now?
Still in presentation mode. So, okay, now it's perfect. Thanks so much. Up to you.
Okay. I don't know what is happening. Anyway,
We
sorry.
lost you. So yeah, so the presentation was shared, was perfect. Yeah.
Is it okay now?
Now it's perfect. Thanks so much.
Okay.
You can start.
Thank
Yeah,
you.
thanks.
Sorry for the hiccup. And thank you very much for inviting me to talk about a little bit about One Health collaboration. I'm from Bangladesh. I'm a deputy program manager for the Antimicrobial Resistance Containment Program under the Ministry of Health and Family Welfare. And my name is Dr. Anindra Rahman. I'll just talk about a little bit about the multi-sectoral collaboration for One Health from obviously from Bangladesh perspective. And also we'll try to share some practical experiences that we have in Bangladesh. In the introduction, I think all the present participants in this webinar, they already know about One Health. If we are thinking about zoonotic infections, the pandemics, and antimicrobial resistance, which all are referred to as key challenges for 21st century, and associated with increased risk of global security, poverty, food security, health, and development, we can see why One Health is going to be very important topic in the future. Because health issues at this human animal environment interface cannot be effectively addressed by one sector alone. And One Health is that collaborative, multidisciplinary, multisectoral approach to address these urgent ongoing health threats. I don't want to spend so much time on the definition of One Health because probably everyone is bit or less more familiar with this. It's an integrated unifying approach that aims to sustainably balance and optimize the health of people, animal, and ecosystems. And this is very important that we can see the communication, collaboration, coordination, capacity building, all things work together for this this important unified approach, right? And this is particularly important because if we can see some recent data that almost 75% of the newly emerging infectious diseases are zoonosis. And 60% of all infectious diseases in humans are spread from animals. Very disturbing facts. If we translate this into numbers, so genetic diseases are responsible for an estimated 2.5 billion cases of illness and 2.7 million deaths worldwide each year. Very horrific number. So why this One Health approach? What is the benefit of this effective implemented multi-sectoral One Health approach? Now, for this thing, we have to consider that this is a very model, this perfect One Health approach is going on. Then we'll probably see these benefits. So the responses to genetic diseases will be timely and effective. All sectors will have information they need. All the decisions that we do will be accurate and based on shared assessment of the situation. All the sectors will be accountable equally, and regulations, policies, guidelines will be realistic, acceptable, and implementable by all sectors. So the technical, human, and financial resources are effectively used. The gaps in infrastructure, capacity, and information are identified, and advocacy for funds, policies, programs is more effective. So these are all the benefits of a very ideal scenario. But we often don't see this ideal scenario, right? So One Health approach has been effectively implemented to address a current genetic disease threat and then abandoned to when the emergency is past. I think many of us have seen this in different countries. This is very normal, actually, I would say. So why it is difficult? Why this lasting multi-sectoral collaboration is challenging? So I think we can talk about many different various factors. I'll just name a few that I find very important. So number one will be obviously the divergent goals and priorities. So different sectors, they're working together, but still they have their own distinct objectives, right? For example, in animal health in Bangladesh, we are a very small country with a big population, 170 million population. So our animal sector, they are more concerned feeding this 170 million population rather than the human health. Like I'm just talking about the actual issue. So these different goals and priorities, obviously, it's a challenge when we want to align these interests. Secondly, I can talk about power imbalance. This is very important, of course. I think I come from Ministry of Health, and if we are thinking about different ministries, Ministry of Health obviously is more prioritized and more resourced department in a government, more than obviously the animal sector. And this imbalance in resources or influence can be a challenging thing for the sustainable collaboration. Communication barrier, this is very vital. Of course, the animal sector will not understand the jargon, the language, communication style we have in human health. And I think this is particularly more challenging in the admin people, the policymakers. They have they have harder challenge to understand those language, those jargons. This is very important. Competing resources and funding. I can stress this more enough, and I will give some example later on about this. So obviously, especially after COVID, I think human health is going to be more resourced, more funded than animal health and or other sectors, and this becomes challenging. Institutional silos is almost same as the first one I said. So lots of department, they are already overwhelmed, lots of work in their hands, so they want to work in isolation, doesn't want to talk with others that much often. And this there's also legal and regulatory challenges because the framework is not there, right? In many countries, the framework is just not present for facilitating these collaborations. And time and commitment. Obviously, sectors have to have the time and commit for the cause. That is important. So how to sustain the One Health collaboration? I'm not an expert, but I'll try to say a few things from my experience and also from the beautiful guideline that the tripartite organizations has developed on One Health collaboration. So what they say that the political will is probably one of the number one thing for sustainable One Health collaboration. I cannot agree more. This high level political will is very important because when we want to align our activities, align our resources, different ministries, different departments, high level political, high level policymakers, they will get involved. And if they are not willing, if they're not committed, then this collaboration will falter. Resources, definitely we will have to have some, it's not possible to have exact equitable distribution of human financial resources across sectors, but we have to go as near as possible. Second two points, context and common goals. These are like similar and this is very important. So although our different sectors have different priorities, but we have to have some common goals, some common context. That is human health, the betterment of the human, and these common goals and context has to be, believed by the sector people. But after this, we will need a strong governance. We'll need a governance structure. We'll need a strong One Health platform, aligned legal and policy frameworks to keep our activities going on. And these activities should be routinely done, routine coordination, routine communication, because we do something and then forget to do another meeting for say, for example, for 1 year, then this collaboration will fault. And strong sectoral system and recognizing success is equally important to sustain the One Health collaboration, in my opinion. So I know these are all theoretical. People might be already bored, but in Bangladesh, I think we have somewhat a sustainable One Health collaboration going on. I won't say it's perfect, but still we have somewhat a bit matured collaboration now. And it all started from the avian influenza and Nipah viral infections in, I think, 2007. And I just want to give a few examples from those times and ours, how we are still sustaining this collaboration so that you can see the example from the theory just I said. So we had a influenza preparedness and response plan in Bangladesh developed in 2006, and that is actually paved the way for discussion among different organizations in 2007 to promote One Health approach in Bangladesh. And all the departments, DG Health, the DLS, I mean Department of Livestock, Environment, they all started talking to each other in 2007, and in 2008 the One Health Bangladesh platform, the civil society platform, it was established in 2008. So after that, in 2013 and 2015, all the ministry, they started approving the action plan for One Health approach in Bangladesh. All three ministries approved this. And in 2016, we established the One Health Secretariat. Currently, it is in the Ministry of Health, IDCR, with seconded officers from DG Health, DLS, BFD, One Health Secretariat Coordination Committee, Technical Advisory Committee. All these things started in 2016, and we developed a TOR and all the objectives for the One Health Secretariat. So just to give you a summary, so in 2008 we launched the One Health Civil Society platform. 2012 we started developing and validating National One Health Strategic Framework and Action Plan, and this strategic framework and action plan were endorsed by different ministries in 2015. And in 2016, we established our One Health Secretariat. And in 2017, we started securing a fixed budget for supporting the One Health Secretariat from the Ministry of Health and Family Welfare. So it was part of our health sector program, and we have some dedicated budget for One Health activities. This is also very important for sustainable, I should not forget to mention. So we have done lots of activities together. We have done lots of training. All those trainings were in One Health approach. The wildlife training, FETP program, it was a very successful One Health collaboration, One Health fellowship, One Health simulation training. We have a One Health Institute at Sivasu, animal health university in Bangladesh. So we do have a One Health event-based surveillance system dashboard, where we have all those information, all those surveillances that we do together, or all those outbreak investigations that we do together. It's a big dashboard. I just give you a glimpse. And we have, I think, mass dog vaccination, which is conducting in Bangladesh in full swing for last 5-6 years, is a very prime example of One Health collaboration. And I just want to spend 1 minute on this, because this is very important example for financial resource sharing as well. So you see, mass dog vaccination is a very important, I think, important tool in controlling rabies infections or rabies mortality. We all know that. And in Bangladesh, this is done mainly by the Ministry of Health. So the budget is coming from the Ministry of Health because it's a big budget required. Lots of street dogs in Bangladesh, so we need a big budget, and that is coming from Ministry of Health. The Ministry of Animal Health, they do not have any budget for mass dog vaccination. This is, I think, a bit different than other countries. But the mass dog vaccination is done in total One Health approach. So the Department of Livestock people, the local administration people, and the Ministry of Health people, they work together very closely during the vaccination. The dog catchers are from Department of Livestock. The vaccinators are from Department of Livestock. The volunteers are from local government. So this way, all the departments are participating in this big mass dog vaccination program in Bangladesh, and very successfully. And we have done other joint outbreak investigation and management. I think in many outbreaks, for example, Nipah, anthrax, influenza. I should not spend so much time on it. And I think I've come to my end of my presentation. I want to talk about the AMR approach in Bangladesh, which is also conducted in very One Health approach. So the antimicrobial resistance containment program, it's a program from the Ministry of Health and CDC. I'm the deputy program manager of this program, and we are the Center for Coordination. So we try to coordinate among different sectors: animal health, drug administration, environment, agriculture, and obviously human health. We try to do the coordination, and I think we are a little bit successful, at least. So all the activities we are doing in One Health approach, we have steering committee, technical committee, core working group, all formed in One Health approach. We have done lots of training, laboratory strengthening, research, policy development, and everything was involving all those sectors as much as possible. Well, we do have problems as well. Our environment department is not that much active in AMR, and that is fine. I think that is a reality. But we are doing as much as possible. I will finish my presentation with this slide. I mentioned about political will, which is probably one of the #1 component for a sustainable One Health collaboration. And you can see our Prime Minister, Honorable Prime Minister Sheikh Hasina, just completed her term as the co-chair of One Health Global Leaders Group on antimicrobial resistance. And you can see she's very much active and very much vocal about this issue, this One Health and AMR issue. She talks about it often in different speeches, especially on AMR and One Health initiatives and research. And this motivates us, all the people that working in animal health or different sectors, to contribute more on the One Health and talk about it more frequently. Thank you very much for listening to my, I think, a bit long presentation. I'm ready for any question and answer. Thank you.
Thanks so much, Dr. Haman. So I think that we can go with the presentation and have like a kind of round table at the end. So, but thanks a lot for your presentation. And so I really enjoy all the kind of multisectoral, description that you gave us, and the effort that Bangladesh put together, to create really like this system. Yeah, so I'm pretty sure that we will have a lot of questions for you after the other presentation. So, but again, so thanks so much. And I will move to the second speaker, which is Dr. Mubashir Farag. So he's the head of Communicable Disease Control Program and Protection and Communicable Disease Division, Ministry of Public Health in Qatar. So Dr. Mubashir Farag is a senior infectious disease epidemiologist and the head of the Communicable Disease Control Programs at the Ministry of Public Health in Qatar. He's a country coordinator for the International Atomic Energy Agency with a project on the zoonotic disease integrated action called Zodiac. He holds a PhD in communicable disease surveillance and control from the University of Gezira in Sudan, and another PhD in emergency infection disease from Erasmus MC in Netherlands. So Dr. Farag is also a fellow of the Faculty of Public Health, Royal College of Surgeons and Physicians in UK. So he's also among the 10 international experts that were assigned by WHO in 2021 to trace the origin of COVID-19. So without any delay, so I want to introduce, leave the stage to Dr. Mubashir, and thanks so much for being here today. And the stage is yours if you want to share your screen and your presentation. So it's up to you.
Thank you so much. I have a problem with sharing my. Let me see.
We cannot see your presentation.
You can see right now?
We see something from your computer, but not your presentation. So if you let's try again.
So let me use my other computer.
Okay.
Can you see now?
Yes, now, yes. Now, yes, if you can just use the presentation. Perfect. Now it's perfect. Thanks so much. The microphone is all yours.
Thank you. Thank you. Thank you so much. I'm traveling. I'm using two computers. I have a problem with connection. Thank you so much for Infinite and for the participant. In the few minutes, I will reflect on when MERS coronavirus experience in Qatar and how the country respond using One Health, and then how we scaled One Health national response based on the MERS coronavirus response. So I will reflect on the drivers for MERS coronavirus and the risk factors, and as I mentioned, the national response and how we implemented One Health and how we utilize the One Health as the gate for the One Health implementation at the Rush. So this is just the timeline. MERS coronavirus, emerged in 2012, and then from that time till we'll go in the coming, 10 minutes with our journey. So from MERS till we're supposed to be, soon one of the WHO collaborating center in One Health and zoonotic disease. So MERS coronavirus is a novel coronavirus. Just before 5 minutes, we received a notification from WHO. There is a new case reported in the United Arab Emirates. So it is emerging infectious disease. We managed to know it when a first case reported in Saudi Arabia and before that in Jordan. So it is a respiratory as well as it is, of zoonotic origin. Still, we don't have any human vaccine or animal vaccine. Still, it's under the development. It is quite obvious. MERS coronavirus affected several hospitals. There's several outbreaks in Saudi Arabia and other countries in the region, as well as in South Korea. So it became one of the, coronavirus with, to some extent, local versus international spread. Still, there's a lot of knowledge gaps concerning MERS coronavirus. So we started, I need you to focus with me. When we started the whole investigation, when we reported the first case, those are the priority questions. So, and then there's a lot of questions, need resources, it need collaboration, it needs scientific knowledge, it needs technical support from different. And so this is why we need One Health, because we cannot answer those questions without the collaboration between different sectors, including Qatar, outside Qatar, animal health, environmental health, the academia, even the community. They're major part of the One Health response. So this is just to reflect on the science concerning MERS coronavirus. It is a problem, and WHO and the quadripartite, they're still keeping monitoring cases because it will be like SARS coronavirus in 2003. It became so that we can mention it is the first COVID. So we have second COVID, and all of you agree with me how, COVID is, it's really a disaster. It's making pandemics. So we wish it will not be the case for coronavirus not to be the COVID number 3. Anyway, so mode of transmission concerning MERS coronavirus, we have human-to-human transmission. This is mainly in certain settings like nosocomial infection in hospital. There's a lot of outbreaks, as well as we have in certain settings like household. There is also human-human transmission, and we have in also another setting where camel-human interface is happening. The camel market, the camel barns and farms, as well as the racing areas. There's a lot of cases reported. Some of them admitted to the hospital, but the majority, they are asymptomatic or have mild symptoms. So concerning the demographics and the profile of MERS coronavirus, this is like when it came to age, the majority of those affected their male. So this is also, it's like, because male, they are dominant, and the camel business is dominated by male in the region. So median age is between 50 and 45. When it came to the fatality, we need to remember this number. MERS coronavirus is really fatal. When it came to, the death rates and it is very high. We're speaking about 35 of the cases that are died. So this is it's quite obvious in most of the regions, most of the countries, they have this number. So this is why One Health is so crucial, and we need to put still MERS coronavirus under the radar. So this is concerning cases in Qatar. Just this is, I mean, what we have, and it's quite obvious. Also, we have the same profile of cases in terms of risk group, as well as the mortality rate, as well as most of the cases linked with camel. So this is just to reflect on the possible factors why we have MERS coronavirus. So because of the camel farming system, where the biosecurity, the farm biosecurity is very low, as well as it's intensified kind of farming concentrated around cities. And also we have huge and massive camel gathering. This is, I mean, it's going for 6 months, mainly in winter. Camels came from different areas. And also the animal handling practices, the culture factors. In our region, camel, they are part of the family. It's like the pet animal. And there's a lot of wrong beliefs concerning, for example, camel is safe, they cannot transmit, and still till now, we did one study about the perception of those owners and workers. Still, they're not believing on MERS coronavirus coming from camel. So the perception is very low concerning the risk. And then also we have the camel mixing. So camel, they are coming from different areas in terms of age, in terms of epidemiological profile of camels, as well as camel coming from Horn of Africa, coming from Sudan, and coming from the rest of the Gulf. So this is a profile of camels. It's quite obvious. It is increasing. It's moving. There's it is a business. It is a lifestyle. Camel racing is considered as one of the business, as well as the national sport in our region. This is concerning the context, how human-animal interface it's happening. So without any kind of biosecurity isolation. So the relation between here, you can the camel racing track, as well as the camel farms, they are in the same areas. From the camel racing tracks, we have a lot of cases reported in the hospitals and the nearby health centers. And from those centers, patient transfer, some of them, they are asymptomatic, they came with mild symptoms, and this is how the hospital transmission. So between these farms, as well as the camel racing, there's a lot of cases reported. So if you allow me, I can share the film later. This is summarizing. This is how we managed to do the One Health outbreak investigation. So we have the animal health sector, as well as we have the human health sectors. So we have like a joint investigation team. The joint investigation team, we go to the field, so samples and data collected, as well as we have like the communities are part of this. This is, I know this is a complicated, but I can share with you the slides. And then there is a lot of innovation in this, where management, communication, field team, media management, seniors, how the data shared, as well as how the decision making concerning and how we do the risk communication, as well as the community engagement. So this is the platform where we managed to innovate, and where we managed to implement the One Health from the beginning. So when the first case is reported in Qatar, I remember this photo, the undersecretary, and you can see here most of the players, they are here: animal health, human health, environmental health, all of them, they are here, as well as media. They put certain principles. So first of all, they mentioned this is the government should lead. That means the seniors and the higher up. And then during that time, they decided to to take the One Health approach. I will elaborate more on this. And then they build the capacities, as well as they mentioned, we need to do intervention based on evidence. And the community, they need to be part of this. We need to be transparent. I remember when the undersecretary, he mentioned this. So he mentioned we need to be transparent. That means whatever kind of information, it has to be shared with locals, with international. And then they mentioned it has to be in partnership, international or local or regional. So we formulated like a joint national team. You can see, I remember this photo. You can see the veterinary doctor, and as well as our nurses and the health inspector. They are working together, collecting human, environment, as well as animal samples. So part of the response guidelines, I put it in red, which is so crucial for the One Health to be a successful experience. It is the one bucket approach. What I mean, one bucket approach, that means the government. They're the major funding for this. So animal health are requests from the same source, human health are requests from the same source, and they put the whole budget under the Ministry of Health. So this is so crucial to sustain and to manage the One Health at country level. So they make the networking between labs, as well as we fund labs and the technical support. It's huge investment in the country, which is supported by this approach, which is one bucket approach. So when it came to what facilitate One Health approach in Qatar, so we have like an excellent leadership, and also we have a supporting policies, the strategies which is supporting this. In Qatar, we have a research-oriented public health system. So the whole country is supporting this, and even the economy, it's based on science. So this is supported us during, I mean, very much during our response to MERS coronavirus, as well as the availability of funding. So we mentioned it in Arabic. Al-Kash بيغلي النقاش. If you have the fund, you can do whatever you want. So this is so crucial for the sustainability of the One Health implementation. So I will summarize after the implementation of the One Health. What are the great achievements on Qatar? Just you can focus with me. We did timely investigation of all suspected and confirmed cases. Based on this, Qatar is the first country to report that camel can be infected with the virus. We are the first country worldwide, because of the One Health, we managed to isolate the virus from camels as well as from human. And then we are the first country via WHO and the quadripartite, we managed to pilot the investigative studies. So in Qatar, we did the serosurvey, anthropology. We did so many kind of studies because of the One Health approach enabled all such kind of success. And then to some extent, we managed to implement control measures. This is in partnership with the Camel Racing Association, because as I mentioned, for the sustainability and for the good implementation of the One Health, the communities and the high-risk group, they need to be part of the whole One Health process. So just to reflect on this case, still we need to improve a lot of kind of things, because still there's a lot of challenges. The social stigma, this is one of the major factors. Still we need to work on it. And as I mentioned, the low risk perceptions of those workers and owners still. And then still there's a lot of gaps facing the MERS coronavirus sense, the transmission mode, and the role of the asymptomatic kind of transmission. There's a lot as part of the question. Still, it needs to be answered. So this is, as I mentioned, from 2012 to 2015. As part of this, we managed to have a gathering, and based on this gathering, for first time worldwide, they have, or we have, Doha Declaration, where One Health is mentioned is a major strategy for the response and preparedness for MERS coronavirus. And then we have the IHR and the DEA. Till the government, they convince to invest on the best practice we had during MERS coronavirus. Then they develop what we call it the One Health framework. This is a document. We did the assessment. This consultant is a quadripartite. We came and they did the assessment, and we developed our strategy for the coming 5 years. The strategy, it's like cover the leadership, decision making, funding, research priorities, capacity building. So everything, it is under this platform. And then we are moving to operationalize this. And then also the country, they will host, as part of this strategy, the regional WHO collaborating center on One Health and emerging infectious disease. So this is how to invest on the outcomes of MERS coronavirus outbreaks. So still, Camille will be fast, and we have the Land Cruiser. I'm not sure this Camille will stay or sustain. There's a lot of energy needed. The Camille need grass and need water, and the Land Cruiser need petrol, and it need also energy. But I'm quite sure One Health will help the Camille to win the race. So this is a summary of the framework, where you can see the specific disease programs, as well as the AMR. It's like cross-cutting. Then we have sub-technical committees, and this is it will include all. We have thematic groups, and also we have M&E framework. I can mention all of this happened because of the experience we had during MERS coronavirus. This is my golden slide today. I wish
think that we lost Dr. Mbasher. Dr. Mbasher, can you hear us? I think that he was almost at the end, or I think that was like the last slide. So it was great to talk, to hear about camels and MERS-CoV, because MERS-CoV, sorry, because it's very important. So it's a very good example of One Health, and when you have animals and humans connected together, but also the issue with economic and also the social behavior and so on. So I hope that he will be able to join back. So we can just move to the next speaker. So we can open the stage to Dr. Sisai Getachwe. Thanks so much for being here. So Dr. Getachwe is One Health, so it's the One Health Steering Committee. He's chair of the One Health Steering Committee. So he's director of Veterinary Public Health Directorate, Ministry of Agriculture in Ethiopia. Thanks for starting sharing your screen. So Dr. Thatcher has been a veterinary and public health professional for nearly 13 years. He graduated from Jimma University, College of Veterinary Medicine. He received a bachelor degree in public health from Kemede Medical College in Ethiopia. He received his master's degree in public health from the Southern Medical University of China, Guangzhou. And Dr. Sisai has rich experience in teaching, research, community service, and his work has been focused on zoonotic disease prevention and control of antimicrobial resistance, food safety, and other One Health issues. So currently, he's the director of Veterinary Public Health Directorate, as I said before, and he's also a national One Health steering, is in the National Steering Committee, and is coordinating mechanism and platform to support the effective and sustainable implementation of One Health in Ethiopia. Thanks so much for being here, and so I'll leave the microphone to you. Thanks so much.
Thank you so much, Dr. Donald. I would like to thank all speakers, especially Dr. Aninda Rahman, almost just mentioning and went through the main point I'm going to mention. Just I would like to give attention to the practical example of One Health platform that is undergoing in Ethiopia. So hello all. I'm as mentioned, I'm Sisai Pitacho. I'm from Ethiopia, and I'm very grateful to be here today just to talk to you about One Health, sustaining meaningful multisectoral collaboration, and a practical example in Ethiopia. Specifically, I would like to talk about the application of One Health coordination platform in Ethiopia in terms of the for zoonotic disease prevention and control, as well as the AMR prevention and containment. So as we all know, zoonotic disease and the AMR is very complex and involving multidisciplinary as well as multi-sectoral. So we need to have the enhanced multi-sectoral approach. Before I went through the experience in Ethiopia, let me just mention about the One Health. As we all know, is a collaborative effort of multi-sectoral approach, and under the umbrella of One Health, that is embracing, as I mentioned, multidiscipline as well as multi-sectoral, and in cumulative to protect the human, animal, and our ecosystem. Is already mentioned by Dr. Aninda, first speaker. And now why we need One Health approach and what is the benefit of One Health approach in addition to the point that mentioned by Dr. Aninda. And as we all know, global One Health security agenda is just stated to achieve without adding One Health approach is very difficult to achieve the global health security agenda. So we need to think about the effective and sustainable coordination mechanism for One Health. As you see, the major global health security threat is an unprecedented increase in emergency of just new health threat with high socioeconomic consequences. And also the One Health is also the timely health security initiative for moving beyond the current traditional approach to holistic default way of doing business. This is just the sector is doing in the silos for their specific mandate, specific priority, without just considering the contribution of one sector to health of another sector. So now it's very crucial to think and thinking beyond the current approach to the holistic one, which is One Health approach. So when we see the One Health benefit, and by default, when we talk about One Health, in the first place we are thinking about zoonotic diseases. But One Health is beyond zoonotic diseases, as we all know. It's involving foodborne diseases and a chemical event, radiological event, and also the very burning issue of the global health threat currently, antimicrobial resistance, as well as zoonotic disease. This is what I'm just to give emphasis to it by today. And also IHR monitoring and evaluator framework, and also NAPS, National Action Plan for Health Security. This is just the attention from Minister of Health, but it's very difficult to manage by the human health sector only. So when we think about One Health approach, we need to think about these issues. And also to have the effective One Health in place in specific country, as well as in Ethiopia, we need to think about the platform, which is very important and useful in coordinating the collaboration effort of the specific key stakeholders. And then we need to think about the global perspective when we talking about the One Health. The first one is the tripartite. Currently, UNEP is joining these parties. Currently, quadripartite, which is purely One Health approach to address the public health threats, and also One Health Commission, One Health Initiative from different universities within the country, and an international organization. And also One Health Platform Foundation, CDC One Health Platform, and also the events that is promoting One Health, Global One Health Day is a very important event here in Ethiopia. And we use this platform as a tool to promote the One Health approach implementation in Ethiopia, as well as World Rabies Days. And also we are using these tools because of rabies outbreak is very increasing. And now we is undergoing the implementation of dog-mediated rabies control and elimination in the country. So we are using this platform to promote One Health approach very well here now. And also when we see the One Health high level is in the expert panel launched in I think in March 2021. And then it's a joint call for implementation of effective One Health in all over the globe. And also we need to mention possible challenges to establish effective and sustainable One Health coordination mechanism. I would like to just mention two main areas. It's the main challenges to sustain and establish the effective collaboration mechanism. One is multi-sectoral collaboration mechanism. One is the governance and the management. Here we can just mention the political goodwill and also existence of specific One Health government policies and the government funding to implement the effective One Health multi-sectoral coordination. Here, government institutions have their own priorities and the mandates, and they just going to implement their mandate in silos. So this is a very crucial challenges. We need to solve. And the second one is a networks and a partnership. Here we can mention the multi-sector working mechanism and also poor information sharing, communication across the key relevant stakeholders, and also the involvement of all key stakeholders is the main challenges here. Just to have all relevant stakeholders in one table on the table. To deal with the One Health or collaboration efforts all over the country. Now, let me mention some practical example of establishing One Health coordination mechanism in Ethiopia. First, when during the 2005, we thinking about the establishment of National Multi-Sector Coordination Mechanism. Currently, National One Health Steering Committee. At that time, there was highly pathogenic avian influenza outbreak, and we just come together with the key stakeholders and have a National Coordination Committee for the investigation of the outbreak to give the response to the outbreak. At that time, there is a political willing and a commitment of the sectors, and also we established the committee with a multidisciplinary and a multi-sectoral just for specific mission for give the response for the outbreak. But after a while, no continuity and a lack of institutionalization. And then on 2026, we established of National One Health Steering Committee, which is more robust and involving key stakeholders from Minister of Health, Minister of Agriculture, Minister of Environment and Climate Change here in Ethiopia, and UCA, I mean Wildlife Conservation Authority. After that, we established this National Steering Committee at the county level. In our case, we call them the regional level. It's a sub-national level. Under the National Steering Committee, we established technical working group, which are just disease-specific technical working group with clear TORs, what they need to give attention to, and they do have their own annual plan and also the meeting platforms legally. Initially, when we are going to establish this steering committee, we signed the memorandum of understanding between the main key stakeholders, as you can just see from the screen. It's from Minister of Agriculture, Minister of Health, and Wildlife Conservation, as well as Environment, Climate Change Commission. They get together and signed a memorandum of understanding and established this steering committee with voting members of 60 experts and also non-voting members from the partners and the development partners like FAO, WHO, USAID, CDC, and so on. So let me just give emphasis to our memorandum of understanding, how we get this sustainable platform. And under Article 2 of our Memorandum of Understanding, we found background of the agreement. It recognized the establishment of the National One Health Steering Committee, and also formally established National One Health Steering Committee from the core government ministries, namely Minister of Agriculture, Minister of Health and Environment, and also Wildlife. And the National One Health Steering Committee is mandated to facilitate multi-sectoral coordination and collaboration among One Health stakeholders at national and sub-national level, and strive toward the establishment of sustainable institutionalized One Health platform in the country, which has we expect just legally established with full of staff and full of logistic arrangement and so on. So we are just embarking to get that sustainable institution in the country. Beyond this National One Health Steering Committee based on memorandum of understanding. And also this memorandum of understanding is also recognized as a technical working committee, which are established under the National One Health Steering Committee for specific zoonotic diseases. For example, we do have rabies technical working group and anthrax technical working groups, and also another prioritized zoonotic disease technical working group, including emerging and re-emerging technical working group, which is responsible for specific activities for the strategic plan of these diseases. And also the effort of these specific technical working groups to lead initiative for their sustainable control have already begun and are gathering the moment currently. The technical working groups are emphasized to provide expertise forum for tackling zoonotic diseases and also enhance mutual accountability and collaboration among the sectors and promote greater efficiency in management of zoonotic disease and other health threats using One Health approach in the country, like antimicrobial prevention and containment, as well as food safety issues. And under Article 30, we can see the scope of this agreement, and also joint disease surveillance is clearly indicated how we do the joint surveillance by involving these key stakeholders, and also outbreak investigation and responses and preparedness and response planning by just involving these all sectors, and also risk assessment and risk management communication mechanism, information data sharing, also how we can go for information data sharing is clearly stated and agreed between the key stakeholders. And the AMR prevention and containment and the food safety issues, establishment of technical working groups and joint communication planning, also the issues which was addressed in the memorandum of understanding and also implemented currently. I will just mention some points later on. And also an Article 4 purpose of the agreement, as I mentioned earlier, to provide a formal framework for the parties to work together for management of legal mechanism regarding the control of zoonotic diseases and other public health threats like food safeties and AMR, and also from the interaction of public environment and animal trade. And hence the parties through their respective agreements, they strengthen One Health approach in implementing multi-sectoral collaboration, and also they safeguard the confidentiality of certain information and documents during our implementation in outbreak investigation and responses also. And also establish specialized technical working group to lead initiative for sustainable controls of specific zoonotic disease and other health threats as needed, including AMR and food safety issues. And collectively contribute to achieving global health security agenda milestones, and also joint mobilize the resources, surveillance and response to zoonotic diseases currently is undergoing and also implemented in practical ways in the country. Joint formulate national strategy to control and eliminate priority disease of common interests. Example, for rabies and anthrax, we developed this technical working group under One is the platform had developed the strategy for dog-mediated rabies control and elimination, as well as for anthrax control and prevention we develop the strategies, and currently the strategies implemented together with these stakeholders. And also the continual work collaboratively in identifying and tackling emerging health challenges at the human-animal environment interface, and institutionalizing the One Health approach. More than this, with the legal ground through appropriate policy intervention in the country. So let me just mention some milestone we achieved, the main milestone we achieved by this platform. Establish the coordination platform at national and regional level, including the subnational level, which is functional currently, and they had their own plan, and they implemented that plan together. And also we developed the strategic documents, starting from one strategic plan, and also the disease-specific strategic plan. For example, we can mention rabies strategic plan, anthrax strategic plan, and so on, and also the communication strategic plan. And we prioritize the zoonotic disease in the country, and then currently we reprioritized zoonotic diseases just by using this one is a platform. And also we had a preparedness and a response activities, including preparedness and a response plan for disease outbreak responses and the management. Here we can mention COVID-19 responses and using the resources in the Ministry of Health, as well as Ministry of Animal Health sector. Is a good example. We came together and gave responses for the prevention and control of COVID-19. And this is what I need to share. And I will available just to answer the question and raised from the participant. Thank you so much.
Thanks so much, Dr. Giteche, and thanks for all this information about your country and your One Health system. And if I can ask you to stop sharing your screen so we can start to answer some of the questions that we have in QA. So thanks for all the participants, and we have a lot of questions. So I'm going to prioritize the one that they are like addressed for, for all the speakers. And then if we have time, we are going to, go maybe to the one that they are very focused on particular countries. So that I want to give, the possibility to all the speakers to talk, and then also share their thoughts on the different, questions. So let me start with some of the questions from the audience. So we're like kind of like 30 questions. So one of the questions that I want to, ask to all the three speakers. So they say like one of the questions is about, this multisectoral kind of effort. So they say that. So the questions say there is no doubt about the effectiveness of having multi-sectoral collaboration in health response, and One Health is an excellent example for that. Do you have any suggestion how we can align traditional health services modules with a One Health approach and increase the commitment of different sectors and ministries? So I think that this also linked to another question about like you have all these sectors and ministries with their own agenda. Some of you say that during your presentation, but I would like to, ask if you can, give some suggestions to people how to approach these multi-sectoral kind of activities. So how do you put like people at the table all together and then working together? So I'm starting with Dr. Oman, and then Dr. Ebwasher, and then Dr. Giteche. Thanks.
Yeah, thanks for the question. I think it was asked by Ms. Shri from Thailand. Anyway, so regarding how to align traditional health service module with One Health approach, I think this comes later. Before that, you have to have a sustainable, working One Health platform going on, and you will have to have the discussion going on. So I think education is going to be important. So One Health idea should be in medical education curriculum, in the veterinary education curriculum, so that everyone is well oriented with the idea. Then only you can start, aligning those health service, regular health service module. So it's not only the outbreaks, it's not only about those emergency issues, but it's also the regular health service module running in One Health approach. So it will take time. I think it comes a bit later, but the ongoing collaboration, ongoing discussion, and obviously the political will of the policymakers is going to be needed.
Thanks so much.
Thank you. Thank you so much, Rahman. Just to continue, it has to be a scientific kind of thing. So you need to do a need and situation assessment. So the need and situation assessment, it will give you the priorities. So you please remember this need and situation assessment, and it will lead you to what kind of priorities. Is it AMR? Is it food safety? Is it something? Is it a vector-borne disease? And then doing the priorities, it will help you what kind of capacities you have, funding, resources, what kind of stakeholders you have in your country. And it will help you to have like a platform, governance or the One Health, what are the priorities, and who will fund, who will implement, who will govern, who will support. And then also in between, you will have the challenges, what kind of challenges you have in your country. And then let us be so frank, there's a historical problem between physician and vet. Like myself, before entering the medical school, I wish to be a veterinary doctor. It's still. So this is why my communication with vet, and I love veterinary because it is a science, it is life, it is more than dealing with one body, which is a human being. So, and then you will have the communication plan. The communication plan, it will be how we do communicate between those three sectors: environment, animal, who will communicate, the focal point, what kind of communication and data sharing, those kinds. So it is a series of steps. It is not one medicine, one drug, it will fit all. What is happening in Bangladesh, it will be totally different what is happening in Qatar and then. And I saw a lot of questions concerning why the focus in emerging infectious disease. What we presented is just example, because in the end, One Health, you need to pilot in one best practice, and then you can scale up, you can build things based on that piloting. After you have everything, you need to pilot. Is it brucella? Is it food safety issues? Is it environment? Pilot, examine, evaluate, scale up. And then pilot again, evaluate, scale up. Then when you will have a One Health, real One Health. Thank you.
Thanks so much, Dr. Golasha. Thanks a lot. And I know what you mean, like be a veterinarian, maybe inside a room with a lot of physicians. I mean, yeah. So, Dr. Keswich?
Yes, thank you so much. I could say how to just align this health service with the genuine One Health approach. In addition to what already mentioned, the creating the condition policy environment in the country is very crucial. This is maybe seen by the willing of political leaders in the country, and also revising the legal ground of the specific sectors that we could expecting to involve in the One Health approach, especially the public health sector, animal health sector, and environmental health sector. So I think it's very crucial to revise the legal ground, which could be consider the issues of One Health within that legal framework, other than the mandate they have is in the silos, working in the silos. Thank you.
Thanks so much for your answer. So again, I'm just like merging some of the questions together because they are almost on the same topic. So the next one, and for me, it's also very crucial, and I think about a lot of people, is the sharing of data. So some questions they ask about like sharing data from, for example, one sector, when you have the dashboard, and then you have these data in the dashboard. So are those data shared across sector, across ministries, or is like if something happens? So for example, for MERS, there was a question about like, oh, is something got captured by the Ministry of Agriculture or by the veterinarians? Is that going to trigger something at the human level? So again, so we can go on the same kind of series as before. So Dr. Hammer, if you want to be like short, just because for all the three of you, we have like a lot of questions and not a lot of time. Sorry about
that. Yeah, thank you. I'm not sure if I understood the question properly, but if it is about data sharing, so in Bangladesh, what we do, so yeah, we do have a dashboard and we gather all the information that we can collect from different sectors and present together. And I forgot to mention during my presentation, we do organize One Health conference regularly. So these conferences are very popular. Like this year, almost 700 participants participated in One Health conference, and all the ministers from different sectors were also present. So this is also a big data sharing platform, right? So different research activities that are being presented in the conference through poster presentation or different presentation, those also worked. And regarding the important data that is sometimes, it's a need from the international organizations as well. For example, WHO or World Organization for Animal Health, they have their own kind of tools to gather data. And because these organizations are working together, tripartite organization, so it also facilitates in combined platform, having a combined platform in the country. So, but as I mentioned previously, all this builds upon the trust and the communication that you have already, right? So if you are regularly communicating with different sectors and you have some good collaboration going on and you trust each other, then this data sharing can happen, and this is very important.
Thanks so much.
Just to continue, thank you so much. So data from needs, still we have a system for data sharing. Again, we need to do like a need assessment, a situation assessment, what kind of data, what are the platform, and then what prevent sharing of data, because there's a lot of legal barriers, a lot of psychological barrier. I can tell it, because sometimes you are the human sector and the animal sectors, because we don't have any kind of agreement, because in the end we need to do some sort of agreement to ease the data sharing, and we need to forget also sample sharing, because when health, to some extent, it needs genetics sequencing of things, because in the end it will help a lot, like antimicrobial resistant and the emerging infectious disease. So after we're done with the analysis, we need to investigate challenges facing the data. What are the barriers? What are the opportunities of sharing the data? Because there's a lot of systems. Sometimes it is not the human factor, it is system. Because I have my own computer system, it cannot be linked with the animal health system or the environmental health system. So how to make this platform? Sometimes the technical issues facing this. Sometimes, by the way, it is only psychological barriers. Only that we have the willingness, we have the approvals, we have everything, but the psychology between different sectors is preventing this. This is why we need to do some sort of trust building activities, sitting together, speaking together. This is why conference, workshops, retreat, joint field things, it will ease. Frankly speaking, sometimes leaders, if they have issues concerning sharing of data, also sometimes like Rift Valley. Rift Valley is affecting the animal side. And then there's a lot of kind of economical implications and the security implications. So it is not like one answer. It will fit all. In different countries, they have different settings. I can tell you in Qatar, the issue of data is well governed. It's easy to share data, but still we need to invest on the platforms. What kind of surveillance system, who will do what kind of data, what is the limit of sharing, what are the IT platform, those kind of things is preventing data. But still a lot of effort need to be done in this area. Thank you.
Dr. Tacho, can you hear us?
Yes, I can hear you
yeah.
now. Okay, thank you so much. Just regarding data sharing here in Ethiopia, data sharing between these stakeholders sectors are very important and crucial for the effective implementation of One Health, as we all know. But here, as I mentioned during my presentation, poor communication and sharing of data is here, and no formal data sharing platform as mentioned from Bangladesh, which is very advanced. And we share the data between each sector by just publication of the research output on One Health. And also data sharing platforms like not as informal to share the official data, health data between the sectors. And also just exchanging the health service reports is based on the request of each sectors without just having established the formal data sharing platform in the country. Currently, we are embarking to just develop a common database system, which is allow the sectors to share the annual reports of the health services and from both animal health and public health side, and also the surveillance data which is generating from both public health and human health sector. It's almost under development to have that platform database system in the country to share the data between these sectors. Thank you.
So Donald, just to add, I know.
Go.
Yeah. So when talking about the data, there is different level of data. So we have the national level, which is between the headquarters of the quadripartite, and then we have the intermediate level, and then we have the field level. This is to be at the sub level. So this is how we tackle data sharing and information sharing between different sectors, and then not to forget the United Nations, the quadripartite. If they manage to have a document, which it will be about the data sharing between WHO, FAO, and UNEP themselves, it will help countries, and it will set the practice, and it will set the platform for the countries to share the data. So, for example, brucellosis, avian influenza. They have, like FAO and OIE, they have their own platform for reporting. If they put something, they need also the animal, so they need those kind of data. It has to be consulted, whatever, with as One Health. It will ease countries. It will help the countries to implement this. I can tell my manager, I need the data of the animal health, because WHO, they mention in their format, we need also the other sector data. It's many, but right now we don't have this. They started to do this with COVID, but still there's a lot of journeys. And then how we share data. This is this is a very easy question, because in the end, if we have the platform, if have the willingness, if we have the know-how, if we have the mindset, the platform, it will be easy. It can be newsletter, it can be website, it can be joint reporting. It will be up to the country.
Thanks so much. So I think that we may have just one question, and then we can close it. I will ask the speakers to be, close. So this is something that it's linked to what you, Dr. Emre Basher, you say at some point when you were like listing the people at the table, and then you say media, and then was also mentioned by Dr. Rahman and Dr. Gadachwe. And usually people, when they talk about One Health, they talk about, Ministry of Health, Ministry of Agriculture, environmental, but very few people, they talk about like media, how can media maybe can promote behavioral change and so on in people. So again, I would like to ask you if you can just give like a short, comment about the importance of media and how media were like handled in your country. So starting with Dr. Rahman, then Emre Basher, and then Gadachwe. Thanks.
Thank you very much. And I think I should have said this about in my presentation. Media plays a very, very big role in sustaining the One Health platform. And we understood that importance. And I think for last couple of years, in most One Health activities, we do invite media people so that they start to understand the concept and also start to talk about it during their presentations, during their news. And it actually played a big role, specifically during COVID. So, and also during Nipah virus thing, and also now that Bangladesh is trying to strengthen the pandemic preparedness activities in One Health approach. These media people, they are helping us a lot in this regard. So I think because the issue is not that simple, it has some complexity in it. So it takes time, but it is very important that they are with us in every state. So for example, if we have a conference, if we have a workshop, just take them along, and they will start slowly but steadily, they will start understanding the concept and will help us in the path.
Just to add, media, it can play a very important role. Like for example, most of the emerging infectious disease, it will coming from high risk group. So at this level, media can help raising the awareness. The risk perceptions, as well as it can be the platform for risk communication. I remember one funny. It is not a joke. It is something we noticed during 2012. One of the Bangladeshi workers, he's working during camels. He gave us a lot of information about MERS coronavirus, its origin, and I was so surprised. I asked him, from where you got this information? During that time, WhatsApps, you can imagine, this is in 2012. He mentioned, I got this information. We have a WhatsApp of the camel workers in the Gulf region. So they mentioned, hey guys, please be aware, there is a disease. And it's, so you can see media, it helps a lot. And also media, it can give, it can generate the new momentum. Policymakers, they need to support One Health. No ways, they need to support One Health. So if we train journalists, they can work with policymakers, and they can do a lot of political pressures, and then they need to support One Health, data sharing, and also government, they need to fund. So media, they can play a lot. And also media, it can help with, for example, during pandemics. Media, you can see the role of media in different countries concerning antimicrobial resistance. There is a lot of kind of positive role they can play. But not to forget, Donald, media, they can play a negative role. Like the, vaccine hesitancy concerning the COVID. The origin of I mean, like there's a lot of kind of miscommunication and I mean, like again, I mean, negative movement because of media. This is why media, it has to be part of the One Health. And right now we are speaking about social media. So that means the communities, they need to be part of it. And also doctors, veterinary doctors, they need to be part of it. Minister of Health, the One Health platform. So media itself, it can play a lot, and it can, I mean, it can make a positive movement. And also not to forget, pandemic, it will not stop. So media, they can play like a positive role in preparing communities. And also, you know, our mind is so lazy. People soon, they will forget we have a massive outbreak, which is COVID. But media, they need to remember countries, animal health, all of them, they need to be ready, they need to be alert, they need to be, I guess pandemic, no need. With pandemic, it's like media, they can play great role as I mentioned. And also not to forget, Doland, media in our region, because right now we have the quadripartite, we have a great opportunities. This is just to reflect on Dr. Haysam's question, because he mentioned, how in our region we can establish One Health. So media, it can help with promoting the joint plan of action. I can tell you, in the last 3 years, we have a lot of great opportunities to move ahead with great One Health implementation, program management. So we have the joint plan of action, which is most of the priorities, global priorities is there: food safety, vector-borne disease, antimicrobial resistance. So it is high time for media. They have something they can advocate, they can make.
Dr. Marshall, I think that we need to, sorry, I really agree with you. And, you know, I will stay here for all day talking with all you three. So I want to just like give like few, you know, sorry, Dr. Grewal, but just like a little bit also to listen something from you. And then...
So thank you so much, because sometimes if it is One Health, really, it is my life. It is like water and food. Yeah, so it's like, this is just One Health is a solution. So One Health is a solution. We need to implement One Health. Thank you so much, all.
I like a lot of your energy, and I wish that all countries got the same energy. And I see energy also in Ethiopia and in Bangladesh. Yeah. But
thank you so much, Dr. Donald. Maybe let me just add some pointers for the question raised from someone. Just to give some comments for the establishment of disease-specific technical working groups. I think first we need to have a legal bindings to establish the specific disease technical working groups, and also we can do it via a memorandum of understanding. And also for specific technical working groups, TOR, within the TOR, we can just capture, state all the scope of the responsibility and all of the things that we plan to do by that technical working groups. And also we need to have joint annual action plan together with the key stakeholders which involved in that technical working groups. After saying this, maybe regarding the media, media has a very great role in sustaining and also establishing from initial to advancement of the multisectoral coordination, that is One Health approach. As is mentioned by Dr. Farag, media has both disadvantages and advantages, but we can just talk on the very importance and advantage of the media. First, we need to capacitate the media personnel as well as the media institutions or organizations, how they will engage in covering the One Health issues. And then after capacitating, after training the media personnel, we can use them to promote, advocate the One Health issues to sustainably implement this multi-sectoral coordination mechanism. In our case, initially we trained media personnel, including the individuals, which is very interested in covering the issue of One Health in the country. After we trained them, we involved in every step of implementing the specific disease prevention and control strategy implementation, especially WEBi and also AMR. We can mention those, and the media is actively engaging in that area. And also the power of media we appreciated during this engagement of them. They can even able to improve the policy ground in the country, and put the impact is on even policymakers to have the One Health policy in the country, as well as to just improve the policy that is supporting One Health approach implementation in the country. Thank you.
Thanks so much, Dr. Gatecha. And thanks everyone. So I think that I know that, as I said before, I will go and then talk about this forever and ever, but unfortunately we have some time, just to talk about this. But so what I want to say that we are going to talk more about One Health in these webinars in the future, so remain tuned. So the next webinar will be also about the workflow, the workforce on One Health. So it's another topic linked with multisectoral, about people working in, and then so how do you keep a kind of system with a workforce inside. So I really want to say a big thanks to Dr. Rahman, Dr. Mubashir, and Dr. Gatecha. So I hope that I say your name the right way. If not, I'm sorry. So because sometimes happen also with my name, that people they say in a different way that I expected. But again, so and really your energy, all the information that you gave us and everything was like fantastic and terrific. Really, I really appreciate that. As a veterinarian working in this field, and then I work on Lyme disease, Western virus, many vector and non-vector disease, and linked with zoonotic and so on. So it's amazing to see what you have done and what you have achieved in your countries during all your activities. And thanks so much, really. And I'm pretty sure that our audience really liked what you have said, and then your energy.
Thank you. Thank you.
Thank you so much.
Thanks.